Thing is this. Let's start with the pectoral girdle. And part of that pectoral girdle is composed of the scapula as well as the two clavicles, but we'll work with the scapula. So this is our scapula, and this is the anterior view right here. Now this is called the subscapular fossa. And a fossa is anything that's going to be smooth and indented, and it's going to receive something. It's going to receive a muscle, which you'll learn in a couple weeks from now. So this is the anterior view, and then flip this over. This is the posterior view. And if you take your hands and you go on your back, you can feel like this bone coming across. So this is the spine of the scapula right along through here. And so what we have now is we have another fossa. We have one above the spine and one below the spine. The one above the spine is called the supraspinous fossa, supra meaning above the spine. And then we have one called the infraspinous fossa. So infra means below, so below the spine of the fossa. All right, so this is the spine of the scapula. And now we have three processes, three important features here that we want to know. And if you remember the acronym ACG, A, C, G, this will help you to identify those. So the first one, we're going to come up the spine of the scapula and come out here to the very top. So this is going to be the acromion process. That's A. C, it's called the coracoid process. And coracoid literally means bird's beak. So coracoid, CC, caw, caw, caw. Think of it that way. And then the G is the glenoid cavity. In the glenoid cavity, this is going to receive the head of the humerus bone, just like this. It forms a ball and socket synovial joint. Okay? All right, so anterior view, anterior view. All right, and then from there, we can start putting in our two humerus bones, just like this. All right, so let's take a look at the humerus bones. So how do you know if it's anterior or if it's posterior? Well, what we have is this. On the back side, we have this large divot here. And so that large divot is called the olecranon fossa. So you remember last week when we were highlighting all the terms on the worksheets, and I said OTC, and I said you'll learn that this week. Well, that's where that's coming in. So this is the O, olecranon fossa. The T is this smooth part through here. This is called the trochlea. And then the C part is this right here. This is called the coronoid fossa. Okay? So posterior to anterior. O, olecranon fossa. T, trochlea. C, coronoid fossa. Okay? There's a smooth part right here, and this is called the capitulum. And capit, C-A-P-I-T, literally means head. So if you've heard somebody being decapitated, the head is removed. So that capitulum process is always going to be lateral. And so this will help you to identify if something is medial or if it's lateral. So this is lateral. So you come up, all the way up, and then what we have here is a large bony process right here, and this is called the greater tubercle. And then this one here that's more medial, this is called the lesser tubercle. And then there's a groove here that exists in between these two tubercles called the inner tubercular sulcus, right along through here. So you get confused with this, find the capitulum, it's lateral. The greater tubercle is always lateral. The medial tubercle is always, the lesser tubercle is always medial. And then we have the inner tubercular sulcus. Okay? Put this back here. Next thing that we've got is our two bones that make up the forearm. We have something called the ulna, and then we have the radius. So if you look at the ulna, it has a U shape here for the ulna. And if we had OTC here, we're going to see OTC here as well. So the O up here is going to be the like this. So this is going to be the olecranon process. The T is going to be the trochlear notch, and then the C is going to be the coronoid process. And when you put the two bones together, what it creates is a hinge joint, just like this. Okay? So we got OTCS, one of the ways you can remember that. Now, when you're putting this together and you're trying to figure out, wait a second, does this bone go on the right side? Does it go on the left-hand side? How do you know? Well, if you look at this little notch right here, this is called the radial notch. And the radial notch is always going to point laterally. And what it does is it serves as like the little pillow for the radial head of the radius to rest on, just like that. And so what it does is it allows the radius to rotate and forms a pivot joint, just like that, so you can do supination, protonation, supination, protonation, okay? So radial tuberosity, this little triangular process here, radial tuberosity. We've got the head, and then down here on the distal end, this is going to be the styloid process of the radius. Okay, so put all this together just like that. Okay. So styloid process is going to point laterally for the radius, and then for the ulna, styloid process will be pointing medially. And then looking at your hand here, okay, it goes just like this. And so the radius terminates at the carpals and then at the base of the thumb here. Okay, so that's how you can remember that. And then on this side, same thing. We're going to take our ulna, we're going to look to see that the radial notch is pointing laterally because our radius is lateral. And we put these together just like that. Okay, so styloid process is pointing laterally for the radius, styloid process for the ulna is pointing medially. And then we put our hand at the very end. You know it's correct because the radius terminates at the carpals, and then right here we have the thumb. You use your thumb to turn the radial knob. Thumb, radius. Okay? All right. So, scapula, we got it. The two humerus bones, we got it. Ulna, the radius, the hands, we got that. So let's now work down to the pelvis. We'll push this aside a little bit, just like that. There you go. All right. So what we have here is our two coxa, and when you're looking at this, and you're trying to figure out, is it anterior, is it posterior, what am I looking at here? Well, the roughened border that you see here, this is always going to be pointing anteriorly. So you always want to look at this and see this pointing anterior. And then on the side here, you've got this cup. This cup is called the acetabulum. And the acetabulum is what's going to receive the head of the femur bone, just like that. And it forms another ball and socket joint, which we'll get to in just a second. All right? The coxa is made up of three bones. So we have the ilium, we have the pubis, and then on the back, we have the ischium through here. And so some of you are sitting right now in your chairs, and what you're actually sitting on is the ischial tuberosity, this part right here, just like that. So if somebody's ever sat on your leg before and you're like, my God, you have a bony butt, what's that about? What you're actually feeling is this right here. It's the ischial tuberosity. So if you get confused on your lab practical, think ish. You have a bony butt, ish. Okay? So this last part up here, the top, this is called the iliac crest. So iliac crest, ilium, pubis, ischium, ischial tuberosity, and then laterally we have the acetabulum. And then the last thing is this, we have a large opening here for nerves and blood vessels to go through. That's called the obturator foramen. It's this part right here, obturator foramen. All right, so let's go ahead and start building out the lower limb. So this here. So connected to the pelvis is going to be the femur bone. And so the femur bone, this is the head of the femur. You've got a large divot right here. This is called the fovea capitis, and this is where we're going to have attachment point and blood vessels coming in at this point right here. And then we've got two large bony processes, one here and one here. And these are called trochanters. So this is the greater trochanter here, and then this one down here is called the lesser trochanter. And so whenever you begin to put this together, this is where laterality is going to make a huge difference. The head of this femur bone always points medially, okay? It always points medially, just like that. And so if you know that, and you do, you know that this is going to be the medial aspect, and this will be the lateral aspect through here. So the greater trochanter is lateral, the lesser trochanter is medial. And if you work your way down, what you're going to have is you're going to have these smooth articulating surfaces here. These are called condyles. And so this is why it's really important to know if you're looking at the lateral side or the medial side, because of how you would name these. So this is going to be the lateral condyle, this is going to be the medial condyle, and then here on the sides, here and here, this is going to be the lateral epicondyle, and this is going to be the medial epicondyle. Okay? So these are articulating surfaces, and this will articulate with the tibia. Okay? All right, so let's put these together just like that. And then from there, what we have is we have our tibia. And the key thing with the tibia is this. You've got this large bony process down here, this bony structure here. This is called the medial malleolus, okay? Medial malleolus. So if you go to construct the skeletal system here in a few minutes and this is lateral, like if you have it here, that's wrong. That medial malleolus should align with the medial aspect of the body, just like that, okay? Medial malleolus, just like that, okay? Now, why is it important that you know the difference between lateral and medial? Well, in your lab practical, if you get these backwards, that's going to drop you down a grade, okay? The reason for that is this. Medial epicondyle, medial condyle, lateral epicondyle. Here, you've got the medial condyle, lateral condyle. So right there, 1, 2, 3, 4, 5, 6 things that you need to know. Okay, so don't rush through determining laterality. Make sure you take a few seconds to figure that out. And then as you work your way down, you can see the medial malleolus here, medial malleolus there. Okay, this bone right here is the fibula. So when you look at the fibula, here at the very top, this is the head. And if you get confused with this, you see how the head has sort of like a U shape? Think about that as saying up. It goes up. And so it's going to attach at the proximal end of the tibia. And then this part down here, that's kind of flat-like. That's called the lateral malleolus. Okay? Lateral malleolus. And so if you begin to put these together, just like that. And then this one over here. All right, just like that. All right, so that's the lower limb. And then from there, we can attach our feet. So when you're thinking about your feet, where's your big toe right now? Is it medial or is it lateral?
Medial.
Medial, good. All right, so it's medial, okay? All right, so what we have here is we have the talus. This is the talus, and the talus is going to directly articulate with the tibia. So TT, tibia, talus, just like that. And then just below the talus is this bone right here. This is called the calcaneus. So if you remember in lecture day, I was saying like as you work your way down, the bones get really small as far as like what the bones are actually receiving as far as weight. So look at these two bones right here. This is what all the body's weight is forcing pressure on. So it's a lot if you think about it in a very small area. So talus, tibia, calcaneus, and this region through here is called the tarsals, metatarsals, and then you have what? Phalanges. Good. All right. So that is appendicular skeletal system. Okay. So questions on that? Okay. The last thing is this. These. So what we have here, okay, we have the sternum, but coming off the sternum is going to be the two clavicles. And so it's going to look it's like that right there. And so these distal ends of the clavicles, they actually sit like this. and it forms something called the acromioclavicular joint right here. Acromioclavicular joint, just like that. Okay, so there's your clavicles. All right, questions? Sternum. Got that? Sacrum. All right. So if you take the coxa, you see this roughened border right here? That roughened border is going to receive the sacrum just like that. And it forms something called the IS joint, the iliosacral joint. And then the joint that I'm clapping together up front, that's called the pubic symphysis. And so you'd have a piece of fiber of cartilage where these bones are tapping. And if you go back to what we were discussing in lecture today, we can look at the three different things here. We can look at the flaring of the ilium, we can look at the pubic arch, and we can look at the pelvic brim to determine sex of a skeletal system. If we find one with no flesh on it, we couldn't identify who it was. Okay? All right. So, your job tonight is